All right, so we're going to demonstrate how to do a wrap for a quad strain. You could also apply this to a hamstring strain. So all you would do, the athlete's in the exact same position, you would just move yourself to behind the athlete and then go ahead and tape for that hamstring strain. So we'll go through it though as a quad strain. I'm going to get the athlete in a lunge position, so take a step back there. We want to keep the knees slightly flexed. Make sure when you're wrapping, because we always want to reinforce good mechanics, make sure that the athlete's knee is directly over their toe. And again, you just want a slight flex in the knee. With this wrap, whenever possible, you want to do it up against skin. It'll stay better if you can. And you can also use tough skin. So when the athlete gets running and sweating, a little bit of the spray underneath will help that tensor stay in place a little bit better. We also have a couple other add-ons that you can do. So if the athlete suffered a quad strain to a very specific part of that muscle, let's say they strained right through their vastus intermedius, and we want to give some more specific support, we can use some foam. You would cut out a rectangle similar size to the area that was strained initially or where they're feeling the most tenderness, and you can use that underneath of your wrap to really pull in focus of where are they getting the compression. You can also use a donut. So let's say they got a knee to the quad and they had a pretty nasty contusion. Most of it is healed up, but there might still be some point tenderness right where they got kneed. You can also put a donut around that area. So then when you do your quad wrap, you're still got a little extra protection. So if they were to get hit in this area again, it's not gonna hit the spot that they were originally hit to begin with. I'm gonna leave those out for the purpose of the demonstration. And so this is what we would do for just a straight up quad strain. So start with a little bit of spray. Now, in order to get started, you really have to know where the athlete is tender. So we would just say, where does it hurt on your muscle? Let's say she kind of felt it more in her vastus lateralis. And when I palpate, she's tender from right about there, it starts to get tender, and up about 4 or 5 inches to about there, and then up here it feels okay. So if we know this is our tender area, we want to make sure that your wrap is starting below and it's going to go and cover the area above, with most of the focus being on obviously the area that's tender to palpate. All right, so we're going to go ahead and use the elastic tensor bandage. There's different sizes that you can use of this. I always stick with a 6-inch wide, but there are single or double tensors that are either 5 yards or 10 yards long. So you can make that decision based on the size of your athlete's leg that you're trying to cover. So again, bring that knee into slight flexion, keep all your weight on this leg. We're gonna start below the area that was tender, okay? Now, whenever you're applying force in the bandage, I'm gonna do one wrap around that's really just about 50% stretch, okay? 50% is about our base level. That's what we would apply all the way up. That would be kind of like a normal amount. So we're gonna do one of those around to hold it in place here. And now when we get into our directional support, I'm gonna add and do more about 75 to 80% stretch just across the tender area. So when I get here, I'm gonna come up, put about 75% stretch there, and then when I get to go around the back of the leg, I'm back to that 50%, okay? And now when I come back the second time, I'm actually gonna change my angle. So my first time across, I was angling it up. Second time across, I'm gonna go back to that 75% stretch, and I'm gonna angle myself down, okay? What we're doing here when we go around is we're creating almost a weave pattern, because it'll actually stay on the athlete's leg a lot better than just doing a spiral all the way up, because a spiral tends to slip, and halfway through practice or the game, the athlete comes over to see you and their wrap is all the way around their knee. So by creating this weave pattern, alternating, one time across it you go down, next time across you go up, okay? And you always want to overlap your wrap about 2 to 3 inches each time. So I'm going to get the athlete to hold that, okay? So if you want to take a look, you can see the distance that each time my wrap has increased, okay? So I'm moving my way up by a couple inches at a time. The point where the tensors cross is the area where you're going to get the most support, okay? So this section here is where you're going to have most of the support, which is great because that's where she's tender. Now, if I was doing say a VMO strain or a hamstring strain, I just want to change my position. So where I change the angle is exactly where the injury is. Once we finish with the tensor, we're going to go around once with our elastic tape just to hold it all in place. Okay, so again, this does not need to be too tight. You don't want to cut off any blood flow to the area, and it's really just to hold the tensor in place and make sure that it doesn't come undone. If I'm worried about this slipping down, so the closer you are to the knee, the more likely it is that this might slip, you can also add one round so that you're half on the tensor, half on the skin, and that will help prevent the tensor from slipping. Okay, and that is good support if somebody has a quad strain and they're trying to return to play.